Hi everyone, I'm Alex, and today my video consists mainly of how to execute your own therapy exercises at home as opposed to being in a clinic. So, if prescribed as given exercises for a certain problem by your physical therapist or occupational therapist, you can perform them in the comfort of your own home, and using a video demonstration, your therapist could execute similar ideas to perform their own exercises. Alright, so today I'll be focusing on drop foot, and drop foot is typically defined by Mayo Clinic as damage to the peritoneal nerve in the leg. By pinching or damaging this nerve, your body has muscle issues that ultimately prevent lifting of the foot in a more vertical direction. So, as you'll be able to see here, I will demonstrate how to perform exercises that can help strengthen those muscles, regain the nerve exercises, and ultimately help improvement if you are someone or know someone who suffers from drop foot. So as you can see, I'm here in the comfort of my own home. Nothing fancy. I'm in a simple pair of athletic clothes, something I'm comfortable in. I'm in my very own living room. And I have my foot placed on the floor. I'm sitting here at the edge of a chair. And first and foremost, I'm going to simply demonstrate plantar flexion and dorsiflexion. By moving my foot in a vertical manner like this, by lifting my toes up off the ground and focusing weight on my heel, I'm exhibiting dorsiflexion. And ultimately, what happens is that drop foot causes a lack of dorsiflexion, which causes the foot to drag down during walking and can cause issues such as tripping, falling, and difficulty with ambulation. So what I want to do before I warm up today, or before I get going today, is warm up, and that's going to include just simply lifting my foot a few times in the dorsiflexing position, making sure I have no braces, no socks, nothing on that could restrict my motion, and just making sure those muscles are getting warmed up. Secondly, what I want to do after that is kind of ultimately execute plantar flexion, and plantar flexion is the opposite of dorsiflexion, putting more weight on my front forward toes. And this is working the muscles which are the antagonists to that of those working towards dorsiflexion. So by working both, I can kind of go back and forth between dorsiflexion and plantar flexion just to make sure I'm engaging all muscles, both the ones that execute dorsiflexion as well as their corresponding antagonists. Now today what I want to do ultimately is just slowly lift my foot up and dorsiflex as high as I possibly can. Move my foot up until there's no way I can get my toes any closer to my shin. I want to probably execute about, I would estimate 10 reps, repetition being one time moving your toes up, about 10 times, and do this 3 times over. So 1 rep or 10 reps with 3 sets. Finally, to complete this, what I kind of want to do is you can have do it yourself, or possibly even use another person if you have someone living with you or a close friend nearby, is move your toes and flex them as hard as you can, take a free hand and push down on those toes, ultimately causing resistance. What that does is really forces the muscles to work eccentrically to avoid being pressed back down onto the floor. And by doing so, you're strengthening those muscles in a different manner and really working those muscle fibers in a different way than you would be if you were to be simply just lifting up and down without any resistance. This is going to give you the best results, and those are 2 great ways that you can ultimately work on improving dorsiflexion of your foot and relieving the symptoms of drop foot from back home. Thank you. So as we've seen, you don't necessarily need to go into the clinic in order to perfect and continually do your exercises. Therapists can often prescribe different forms of exercise as well as individual workout plans necessary for patients to recover and perform them in the comfort of their own home. It could save you a lot of time, and by giving out something such as a video demonstration, you can see how the exercises are performed and then integrate them into your own routine at your own leisure. So this is yet another way why technology can be useful in the fields of physical therapy. Thanks.